It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, this is Tammy Patzer, and I'm really excited to introduce today's guest, Dr. Brandon Lemuel. He is a doctor of chiropractic, and he is a family wellness chiropractor and the CEO of Pure Chiropractic, serving Vienna, Virginia, and the surrounding communities in Northern Virginia. I'm going to just call you Dr. Brandon, if that's okay.
Perfect. Thank you.
Dr. Brandon graduated from Palmer College of Chiropractic as one of the top 3 student doctors, top 3 philosophers, and he was among the top 0.06% in leadership. That means that he was in the top, higher than 1% of all student doctors in leadership. He continues to be committed to your health by becoming certified in several chiropractic techniques, nutrition, wellness, pediatrics, and extremity care. Dr. Brandon holds numerous professional memberships, including the Unified Virginia Chiropractic Association, the American Chiropractic Association, the International Chiropractors Association, Council of Wellness Science, the International Chiropractic Pediatrics Association, and the American Pregnancy Association. He has become a sought-after speaker, speaking on health and wellness, stress management, peak performance in life, and leadership. He lives in Fairfax, Virginia, with his beautiful Venezuelan wife, Eros, and their 2 children, 7-year-old Calista and 4-year-old Kyson. In his spare time, he enjoys spending time with his family, exercising, reading, and traveling. Welcome, Doctor. How are you today?
I'm doing awesome, Tammy. I just want to say thank you so much for this opportunity.
Well, I'm really excited to learn more about you because Pure Chiropractic, I think the name really says it all. You really help people from all age groups, from the sounds of like it, from small children to women who are pregnant to other adults. So let's get right into it. You've recently written a book. Can you tell me a little bit more about the book and what it's all about?
Yeah, absolutely. The book title is Pure Chiropractic Health, Let Tomorrow's Crisis Be Today's Prevention. And it's all about getting this information, this vital information out to as many people as possible. Unfortunately, there's a lot of sick, suffering, and over-medicated people in our neighborhoods. And there are people that just do not know where to turn for help. So the primary purpose of this book is to help educate people about where true health comes from.
So as a chiropractor, who would you say are your primary patients? Who do you help?
Well, stress is rampant today, and a lot of disease today is caused by too much stress. It's specifically unmanaged stress. Now, we know that stress can be good, right? If we were exercising, the stress on our joints and muscles and bones does good work for the muscles and bones. But when there is the harmful, chronic, long-term stress, that can start to chip away at our health and well-being and start to lead to chronic health issues such as heart disease, diabetes, cancer, Alzheimer's, and many more health conditions that people are challenged with overall today. But I would say that our primary group of people, as you mentioned, we do see a lot of families in this practice. I kind of like to say womb to tomb. So we see pregnant moms. We're really known for helping moms who are pregnant. But really moms, the veteran moms, just moms in general who are underappreciated and are sacrificing so much of their time, energy, and their health really for the family and taking care of everybody else that they end up on our doorstep and they wake up and what the heck has gone on with my health and wellness? And they're trying to get it back. Another group of people that we see are the busy professionals. We live in, with the practices in Vienna, Virginia. It's very close to Tyson's Corner. We're about 30 miles west of, about 30 minutes west of DC. But we see a lot of busy professionals who are under a lot of stress. They travel a lot. They work long hours. Their livelihood is all on production, and they're looking to optimize their performance. And the last group of people that we see would be the kids. We see a lot of kids in our office, and especially kids that are suffering from conditions such as chronic ear infections, reoccurring ear infections, and breathing difficulties such as asthma. Those are our primary groups of people that we see in our office.
That's really interesting because when I think of a chiropractor, I think about somebody who's going to put my bones back together so that maybe, I don't have a backache, but you're actually describing more overall health issues. So is that one of the things about chiropractic? Do people really understand what it is?
No, that is another reason why we decided to put this book together and launch it. Is a lot of people have there are a lot of misconceptions regarding chiropractic, and so we wanted to educate people about what chiropractic is and where true health comes from. You see, very simply, is that when people come into the office, when we do our evaluation, they do not realize that the nervous system is the master control system of the body. That system controls and coordinates all other functions in the body. However, due to life stressors, such as physical stressors or nutritional or chemical stressors or emotional and mental stressors, that can cause the body not to work properly and cause interference within the communication between the brain and the body. So what we do as a chiropractor is we analyze the function of the nervous system. And since the nervous system is so important, it's encased in armor. We call that the spine. And we make sure that the spine is in proper alignment so the signals from the brain can get to the body and the body signals can get back to the brain. So that's one of the techniques that we use to analyze, to really assess somebody's overall health and wellness.
So if I go to the chiropractor because I have, let's say, lower back pain or my hip hurts, that actually is, I'm in pain. But as a chiropractor, you're actually going to find out why do I have that pain in my hip or my back. You get to more of the root of the problem.
Absolutely. Unfortunately, people believe that we have a healthcare system today, when in fact it's really a sick care system. And I'm boldly stepping out here to educate people about that, because drugs are not the answer to our problems. More drugs does not equal better health. And so we need to come to the realization that if we do not get to the root cause of the problem, it's only going to get worse. And pills, potion, powders, and lotions are only going to mask the issue. So in our office, we help find out what the root cause of the problem is, educate our clients about what that problem is, and then come up with a plan of action of how to fix the underlying cause so they can get their health back.
So do you find that a lot of people, you've mentioned how about drugs and pain, because a lot of people, they think, oh, I'm going to go to the doctor, I'm in pain, they're going to give me pills that are going to make the pain go away, but then they just end up taking pain pills. But chiropractors actually are looking at why are you in pain and what's the root cause. And like you said it, we're looking for health care, not sick care. And in the world today, are you finding a lot of the patients who come to you, are they better educated maybe than people were in the past? Or do they come to you just because they don't know what else to do?
I think both. I think people run out of, how can I say it? They run out of solutions. Nobody's giving them the answer. they are more educated, because I'm finding the longer I'm in practice, the more frustrated patients that I get. They're tired of spending 2 minutes to 5 minutes with the doctor and here, take this pain medication. And if it doesn't work, come back and see me in 3 to 6 months. I think people are getting more and more frustrated with that, and they're wanting more answers. And so with this book here, it's about educating people about where true health comes from, and not just trying to mask the problem, but really get to the root cause.
So what would you say if you're working with different patients as a chiropractor who's trying to get to the root cause? What would an appointment with you, what would happen, say, in my first appointment with you?
Well, first I have to say this: you would be welcomed into our office and not just another number. So we really do have a family environment, and a lot of our patients see the positivity and the warm welcome as if you were already family. So as you come into the office, we would sit down and I would understand why you're here. I want to know what brought you into the office. And most time people are going to tell me, well, I have a headache, I'm having some neck pain, I'm having some low back pain that's traveling down the leg. But really what we start to uncover through this conversation is, what is the life effect? And then we start to realize that people show up in my office because they're unable to sleep. They don't have energy to get through the day. They're not able to go on walks with their spouse or their children. They're not able to work out or play a sport such as tennis or golf that they want to be able to do. So people are coming in, and we need to find out what impact this is having on their overall life, and what is this not allowing them to do. Once we understand what their goals are of coming into this office, then we do a very specific examination and evaluation on the nervous system. As I mentioned earlier, the nervous system controls and coordinates every function of the body. However, when there's interference to that function, the body is no longer going to be running at 100%. So we grab some objective criteria, objective findings of what's going on, and then we can report back to the client that this is what the problem is, the root cause of the problem, and then here is the plan of action that we need to take in order to fix that underlying problem and prevent it from coming back.
So would you say that of all of the things that you do with helping people solve their problems, is a lot of it has to do with education of what is part of their health issue? Like, you talked a lot about stress in the beginning of our conversation. How important is the role of a doctor as the teacher in helping people?
Well, this is a brilliant segue here, Tammy, because doctor means teacher. That, plain and simple. That's what doctor means. It means teacher. It's about educating people. So once people come into our office and they become more educated about what the root cause of the problem is, we come up with a program of care for them to get better, alleviate their symptoms, and help fix the underlying problem. But we really educate people of how to live a healthy lifestyle, so their lifestyle habits support their chiropractic care, so they can live to their optimal health potential. And then in the book, we get into that, and we talk about that in the last second to last chapter, about what people can be doing as far as a lifestyle to enhance their overall health and wellness and complement their chiropractic care. But really, it is all about education.
So, for example, if I come to see you, we do our initial examination, and we figure out what my root cause is. And I mean, I know you're going to say, yeah, Tammy, you're stressed out. I knew that's a fact. But do you discuss nutrition, exercise? What might our treatment plan look like?
Well, the treatment plan is going to involve a series of chiropractic adjustments. And those adjustments are to fix those misalignments that are interfering or putting pressure on those nerves, causing your symptoms such as headaches or neck pain, numbness and tingling in the arms, or low back pain, and then leg pain itself. Those adjustments are fixing a problem called a subluxation. Now, that's chiropractic's term to describe a misalignment that is causing pressure or interference on that nerve. We have specific technology in our office, and we talk about this in the book, of how we can measure what stress is in your particular situation. We know the areas, and we can measure this. So as you're getting better, we can monitor your progress. But it's all about the lifestyle education on top of that. So once you're getting better, symptoms are improving, function is improving, then we're going to discuss what stretches and exercises can be done to help strengthen those muscles and ligaments to help keep these adjustments aligned. Nutrition is our fuel to the body. So we talk about a specific game plan and lifestyle that we recommend in our office regarding what to eat and then what not to eat. And then the next thing is I have to tell you, is that it's all in our head. And when we talk about these things, it's about helping people deal and cope with stress through things such as meditation and visualizations and affirmations, and helping people uncover some strategies to help them deal with, create the space, get out of the noise so that they can actually breathe for a moment and then see what's going on in their life. Because stress builds, and then it starts to overwhelm us. So these are just a few of the strategies that I talk about with my clients.
Well, that makes a lot of sense, because I've been in the media business a long time, and computers were supposed to make being a newspaper editor or being in the media easier. And what it did is it actually made it so that we could produce more than ever before. And then, of course, with today's technology, with Facebook and computers and emails, we're literally sitting, I think, way more than we were ever sitting before. And you're right, the meditation, the visualization, disconnecting from technology is huge. And then, of course, the nutrition, and then the body alignment, because I know for a fact that sitting is not probably the best way to be, because it compresses you
Sure.
all day long. And that's what I really notice when I start to feel really stressed, is I actually feel compressed. And then if I get up and walk around, it really seems to help. So what would you say are some of the big misconceptions people have about chiropractic? I know you mentioned that you have some equipment in your office, and I know there are different styles of chiropractic. Sure. Also, what would you say, again, related to that? I guess I asked two questions. One is, what are some of your technology, or what is the technology that you are using? And then what are some misconceptions about today's chiropractic?
Sure. The technology that we use is called an Insight subluxation station, and that has the ability to monitor stress levels in the body. The truth is that pain is only 10% of the whole nervous system. So by the time that you start to have a pain, that means that an underlying problem has been going on for an extended period of time. But then there's the other 90% of the nervous system, and those are the nerves that control muscles, and then they also go to the organs in the body and can affect things like sinus and allergies, and your immune system, can affect your energy levels, affect breathing, and also affect digestion. So this technology has the ability to see how our body is adapting to the stress that we're under, and then we can monitor progress. In addition, we have digital X-ray, and we can take some motion studies with those digital X-rays to determine the stability of the spinal segments and to see if something is out of alignment and is causing a problem. As far as the misconceptions, this kind of is a segue into one big misconception is pain is the first sign of my health problem. So it's like the dentist analogy, right? That would be me saying that if you go to the dentist only when you have a pain in your tooth, that is the first sign of the problem. But I think as a whole, we can understand that no, that there's been a buildup of the deterioration of the enamel on the tooth, and then eventually it exposes the nerve, and then the pain is there. So if we just wait for the pain to show up, there's been a lot of decay and deterioration already going on. It's the same thing if we take a look at cancer. By the time we have some sort of symptom, that means that we think that that's the first sign of a problem. Diabetes, heart disease, so on and so forth. And another misconception is once my symptom goes away, I am healthy. And that is a big mistake, thinking that way, because that is not true. Is that just because our symptom has gone away does not mean the underlying problem has gone away. And the last one is that because I feel healthy, because I feel good, I must be healthy. And feeling good and being healthy does not equate to one another. And using those examples that I just talked about, those chronic health conditions, heart disease and cancer and diabetes, by the time we have symptoms, that means that the problem has been manifesting for an extended period of time.
Wow. It's interesting because I was just thinking about earlier you mentioned the the children with the ear infections and the breathing, the asthma issues. And I actually know another chiropractor who actually became a chiropractor because when she was a little girl, she had severe asthma and a chiropractor did an adjustment and she could suddenly breathe. And that inspired her to become a chiropractor because it actually helped her with breathing. So chiropractic, I think my big takeaway from our conversation is it's not the chiropractic of, oh, I hurt my back, go in and get adjusted. It's more of, oh, I want to have an overall be healthier, go in and find out how to adjust your life and your lifestyle, get some advice on stress, get some adjustments, eat a better nutritional diet, and have somebody who's on your team helping you to be healthy and instead of going the sick route. Do you find, is there very much pushback with patients about the sick versus the health issues because we do live in a world where with insurance, some insurance does cover chiropractic and some, I guess, doesn't. What is your take on that issue and how people should look at chiropractic care as part of their overall health?
Sure. I think it all it revolves around the value that people are getting, right? We will spend, $5 for a coffee at Starbucks? And that could have devastating effects on our overall health. But why do we do it? Because it's the perceived value that we get from it. I think the big thing is that when regarding this is that we need to take a look at what the purpose of insurance is. And insurance isn't there to make you healthy or help you be healthy. Insurance is there for crisis care, to help soften the burden when you have a crisis, that it doesn't bankrupt you. But today, a lot of bankruptcies are the result of one major event that goes on regarding your health. One major event can bankrupt most families. So the deal is that the way we look at it in our office and the people that we attract is health being an investment, is making sure that they're adding to their health bank account and they're not withdrawing so much. So if you do have some coverage, great. And if you don't, that's okay too. We have a lot of people who pay cash out of pocket for our services, and we have very affordable plans for them to help make care as affordable as possible, including family plans. Oh,
so chiropractic is a family affair. So you start when, like you said, from the womb to the tomb, and
Exactly.
become healthy and keep your entire family healthy with that. So if somebody wants to get in contact with you, how would you suggest they do that?
Well, I think the best way is that they can email me directly. Okay, Dr. Brandon, Dr. Brandon at purechiropractic.com. That'd be a great way to get in contact with me. Otherwise, you visit our website, www.purechiropractic.com. It's being updated regularly, and we're putting the latest health information to help arm people with good knowledge so they can make better decisions regarding their health and their family's health. And then socially, I'm very proud of our Facebook page. You can connect with us there. There's a lot of inspirational and health information. It has information about our upcoming workshops that we talk about, advanced topics regarding your overall health and well-being. And our Facebook page is Pure Chiro Health, all one word, Pure Chiro Health.
Great. So you actually have different workshops. What are some of the topics for your local workshops?
Well, the one that we have coming up right now in this month is all about getting your energy back. And it's about detoxing from the holidays. So it's holiday recovery. People wreck their bodies. Halloween, Thanksgiving, Christmas, Hanukkah, Kwanzaa, New Year's, so on and so forth.
Day.
Yeah, exactly. And it creates a perfect storm. So we talk about strategies to help get over that fatigue, that exhaustion, things like that. So that's one. We've talked about the cholesterol myth. We talked about diabetology, uncovering the different versions of diabetes. We do stress management, all types of workshops in our office. And we're constantly updating them. So there's new information coming out, and we're providing the best content for our clients and followers.
Great. So you have a book, Pure Chiropractic Health. Is that accurate? Yes, Pure Chiropractic Health. Let tomorrow's crisis be today's prevention. And that book is available. You have the workshops, you have the website, Facebook page, Instagram, Twitter, LinkedIn. So you're very socially connected. Yes. Before I let you go, is there any last thing that you would like our audience to know?
Well, I just want to say is that don't believe the misconception that your health is a result of bad genes or bad luck. The bottom line is that your body is designed to be healthy. That is the innate wisdom of the body. The body is designed to be healthy. And then if the body is not working properly, in our office we call it a body signal. The body is trying to tell us something. So my message is to stay encouraged and to stay optimistic and continue to search for those answers about getting to the root cause of the problem and not just masking the problem itself.
Well, thank you so much, Doctor. I really appreciate it. This is Tammy Patzer. Go make it a healthy day.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.